Welcome to CME on ReachMD. This episode is part of our Minute CE curriculum. Prior to beginning the activity, please be sure to review the faculty and commercial support disclosure statements, as well as the learning objectives.
This is CME on ReachMD, and I'm Dr. Emilie Vander. Haar. Here with me today is Dr. Karin Blakemore. We should close this educational series by addressing how we counsel our patients about alloimmune disorders of pregnancy. Dr. Blakemore, these patients are often really scared. They've had a scary pregnancy in the past. How do you help work with them, counsel them about kind of subsequent issues that might arise in their next pregnancy and how to help them through it?
Well, you're right. It was scary, I think, to have a newborn that was discovered to have petechiae and then thrombocytopenia and require extra treatment. And usually it's out of the blue for these couples. Nobody was expecting it in the probate. So when they come to us for the next pregnancy, we can be very confident that we can get them through that next pregnancy and end up with a healthy fetus, almost always. Again, we tend to have more severely affected probands, and I think most people do, where the platelet count in that first baby was so low that we will usually start our IVIG at 12 weeks. We consider the platelet count and not just a head bleed, and the fact that the platelet antigens are showing themselves certainly by 16 weeks. So we start the IVIG early and continue it weekly and continue it all the way up until delivery. While we can be confident and express our confidence to these patients and provide reassurance that the next pregnancy is going to be different, the baby's platelet count is going to be better, not always, but almost always it will be. That's a big burden on the patient, and we have to tell them that. Weekly IVIG with these infusions that take many hours each, and yes, they're very expensive. We definitely need to work through the insurance coverage in the United States anyway, so that the patient has her coverage all arranged in a relatively short amount of time after she's discovered her pregnancy, so that we can get started with that. It's a lot for them to go through. It may take time off from work. It is usually very, very well tolerated, but it's still a lot for them to go through. A fetal blood sampling is something that's also not their favorite thing to look forward to, but is something that we have to counsel them about. And at times, we're going to be doing a slightly earlier than term delivery, although usually we go full term. So that's how we usually counsel them. And because of the burden, it would be really lovely to have a different way of treating the fetus who is at risk, the fetus who is at known risk. And nipocalimab has great promise in this respect. It's a therapy that should work since it appears to be working to decrease the IgGs that are crossing the placenta and causing the thrombocytopenia in the same way it has worked and appeared to work in the recent paper in the New England Journal that you talked about. So I think there's a lot of great promise for the future, and there's a lot of room for improvement and improvement in our understanding of FNAIT in general.
I wholeheartedly agree. There's so much more to be done and so much more to be learned, and really exciting things coming down the way on a very complicated disease. I think it's been a pleasure talking through all of this with you. Hopefully we've given lots of insight and opinions and lots of good information for patients and for you to bring back to your patients, I should say. I am really excited about nipocalimab. I can't wait to hear more as things kind of progress in studies, and hopefully we'll have many new innovations to come in the future.
And I couldn't agree with you more on all counts.
Well, with that, I think our time is finally up. We appreciate you all tuning in today. Thank you so much.
You have been listening to CME on ReachMD. This activity is provided by Omnia Education and is part of our Minute CE curriculum. To receive your free CME credit or to download this activity, go to reachmd.com/CME. Thank you for listening.